My name's Amanda Murray. I'm a nurse practitioner that started a wound care practice at the Great Falls Clinic approximately 2.5 months ago, and just wanted to share a really exciting case with you guys regarding a 59-year-old female diagnosed with a high-grade stage 3 ductal carcinoma. She came to my wound care center with an open fungating wound on the right breast. As you know, fungating wounds are quite rare. I think I have treated one in the last 12 years of being a wound care nurse. The mainstay for treatment of fungating breast ulcerations are metronidazole cream to decrease odor and drainage, and of course that was her goal. She was changing her dressing up to 8 times a day. So I just wanted to find something different for the patient as she was unable to work, had a high amount of pain. And of course was just embarrassed to go out into the community. I did treat her with hypochlorous acid, which is VOSH. I just wanted to treat a broad spectrum of bacteria. We just moistened a Curlex and then kind of fluffed it into the volume of the wound. She did have some undermining proximally and distally in the wound. And that's what we did. She covered that dressing with an ABD pad to accommodate drainage. The patient came back approximately a week later. She reported decreased drainage, decreased odor, and decreased frequency of dressing changes. She went from changing her dressing approximately 8 times to about 2 to 3. I did a DNA sequencing. I did do conservative sharp debridement, which is also not recommended in the literature because of the high vascularity of these wounds. However, I did find it effective to get VOSH in deeper portions of the wound to eradicate bacteria. On approximately the patient's 3rd or 4th visit, we did have the microgen DNA test results back, and it grew out about 6 to 7 more bacteria, aerobic and anaerobic bacteria. And we started treating her with a lipogel compounded with clindamycin, levofloxacin, and zinc. That lipogel actually adheres to the base of the wound and eradicates bacteria that way. So she started using that as her primary dressing. Her secondary dressing was a VOSH Moist 4x4s because the wound was getting much smaller each week. So initially we treated this patient as a palliative care patient, and then I started treating this patient to close. She decreased in volume over 50% each week. After the 2nd week, the patient was actually able to sleep very well at night, return to work, and her normal activities of daily living. The patient was surely more vibrant with each visit, and that was just really exciting to see. Technology is advancing so fast that I think we have a lot of opportunity to grow and learn. So thanks to VOSH and the opportunity to take a microgen DNA culture, this patient closed and she was discharged from my practice on January 4th.